We have some questions that we collected for Dr. Butler. I'm going to read them out loud, and then he will respond to them. And if we have time, and you've thought of some questions, but you didn't get a chance to have a card, feel free to raise your hand. We have about 20 minutes to do this, okay? All right. Let's see here. Okay. How do we break through the paradox of private sector funding for drug pharmaceutical progress and move toward a nonprofit health care for all?
Wow, what a question. How many favor a nonprofit health system for all? Good, me too. It's going to really probably come down to your expression as a people. I think, you know, the lobby, as I pointed out this morning, is so huge and so rich that it's going to really take the real constructive will of the people to change things. That's about all I can say about that.
Right. Would you comment on the implications of Shoden's findings in regards to impact of formal education on longevity and wellness?
Whose reference was Snowden?
Yes, Snowden.
Well, there's no question but education is very, very vital and very important. Education is very much related to longevity in all countries, not just in our country. Education is also related to general happiness. So that one of the great things our country did, really throughout all the critical periods of history, in the midst of the Civil War, they established land-grant colleges, which provided the basis for universities throughout the country. And then after World War II, as some of you in this room know and probably benefited from, came the GI Bill of Rights. And so there's no question about education is critically important. And I'm very concerned that insofar as our relationship to the rest of the world, our young people are something like number 18 and 20 in math literacy and science literacy. And yet the future of our economy so much depends upon literacy with regard particularly to sciences and math.
Do you recommend long-term health care insurance?
If you have enough money, it is actually better, if you happen to have enough money, to actually self-insure. And any of the money that you might have given over to the private insurance company for your premiums, to simply invest it, but keep it segregated as a way of gaining the investment. Because that's the general opinion of most people. This is not a unique opinion of mine. And part of the problem with the private long-term care insurance is the actual carrying out of it. And I'm not trying to say there's anything nefarious, but it's just so difficult. It may depend on what are called activities of daily living, whether you can walk, go to the bathroom, feed yourself, whatever. But then there may be arguments between you and the insurance company as to whether you really have the right criteria to kick in the use of your insurance. So if you're in a position to, I think it's better to try to save separately.
Could you compare the U.S. Alzheimer's statistics with other countries?
I think we're pretty much the same. We don't have all the details we should have. I was just at a meeting the other night, actually, with the leader of French, British, forgotten the other countries, but there are other countries involved. And the incidence and prevalence seems to be about the same, adjusting for age, because, of course, the older a population is, the more likely it is that you will have Alzheimer's. Japan was represented too that night. And Japan, of course, has the longest living people, so in proportion they would have a somewhat higher number of people with Alzheimer's disease. But it appears to be a universal condition, not respecting at all of ethnicity or race.
Okay. How do you think healthcare reform will impact healthcare for the elderly?
I think ultimately to the good, because I used to sit between 1985 and 1989. I worked for Congress on a commission called the Physician Payment Review Commission. And our charge was to try to create a better balance between primary care doctors and specialists. As you may know now in the United States, only 30% of doctors do ordinary primary care. Europe, it's 50%. So we're getting fewer and fewer doctors to just take care of you, and more specialists. Now, part of the reason for that is the terrific expense of medical education. And most students, on average, when they graduate, they have $150,000 of debt. So it's therefore very attractive to go into a specialty where they can make more money in order to pay off their debts, to raise their family, to buy a house, and do all the things that people want to do. So it's a tough one.
Okay, I like this one. What do you consider productive old age?
Well, I wish I could be productive. I think one of the wonderful things about so many older people is they do volunteer, and they participate enormously in each of our cultures, our societies, and that's terrific. And we discovered at studies we did at the National Institutes of Health in the 1950s and 1960s, as I may have mentioned earlier this morning, those who have a purpose in life actually live longer. Having a purpose, a passion, doesn't have to be big time. Maybe it's even taking care of a grandchild. Whatever, something that's important to someone to get up for has a relationship to a longer life. So being productive in old age has both a selfish benefit, that is, you're likely to live longer and more healthily, and it most certainly has a benefit for society.
Okay. If a person has not taken optimal care of their mind and body, what specific steps would you recommend to help offset natural aging?
Well,
I think you had a list.
why don't we do it in the first place? I mean, if you've led a life drinking too much, smoking, whatever, just try to stop, which is not easy to do. I mean, I have a lot of sympathy for people, for example, the problems of weight, because there are genetic components. And it's very easy for us to be a little insensitive to the reality of what it's like for some people who may work very, very hard to control their weight. So I guess the best answer I could give is, even if it's never too late to start. That's the best answer. And it's always too soon to stop good habits.
There you go. Okay. Compared to other countries that spend less on health care per capita, is it comparable to U.S. health care?
Yes. In fact, you have to remember in Europe, for example, and in Japan, everybody gets covered. In this country, we have 45 or more million people that don't get any coverage at all. So when they talk about the long lines waiting in Canada, you have to remember there are long lines of people here, 47 million, who don't have any line to wait in at all. And when we say, well, they can go to the emergency room, we're also forgetting that that actually is a very expensive form of care. And we as taxpayers are paying for that. So it's no big advantage for us to leave people out of the system. The other thing I hate to tell you is we've actually lost life expectancy compared to other countries. Some time ago, we were 11th. We're now 42nd in life expectancy. 42nd. People in Jordan live longer than we do. This is the richest country in the world. To my mind, it's just outrageous that we have not succeeded in being able to find a way to provide health care for every American. And even this issue about illegals, we're not going to turn an illegal away if they have a heart attack and they come into the emergency room. So we wind up paying for all this anyway. It will be more economical. Actually, that's probably part of the reason that, in fact, Europe, Japan spend half as much as we do on health care and get better results. By the way, all of Europeans live longer than we do. Japanese, the longest living of all. So we would actually save money, in my opinion, if we were to have a universal coverage where we didn't have the expense of emergency rooms, where we didn't have the expense of commercial health insurance, but really provided a genuine system of care.